Hey friends, I'm Dr. Molly. I'm a veterinarian, and this is for you if you've ever had a dog diagnosed with a heart murmur, or future you, because this does happen to a lot of pet owners. I just went to a veterinary conference in Nashville, and I went to a great lecture with a cardiologist about mitral valve disease. So a lot of small breed dogs, as they age, will develop what we call mitral valve regurgitation. So it's just a decreased function of one of the valves in their heart, and it often causes a murmur, which is the sound we hear when we listen to your dog. We grade murmurs based on how loud they are, but when we hear the murmur, we can't say for sure what's causing it or how bad it is unless we do more diagnostics, which usually involves some type of imaging. And this is where things can start to feel confusing and overwhelming. And sometimes different veterinarians will have different recommendations that can confuse you even more. For me, if I ever hear a murmur in a dog, especially if I've heard it once before and we're hearing it again and we know that it's real, or if it's a louder murmur, like grade 3, 4, or higher, I'm gonna automatically talk to that dog owner about a cardiology workup, which is the best next step that we can take. So x-rays and an ultrasound of the heart, called an echo, and that's usually either performed or evaluated by a veterinary cardiologist. Eventually, most dogs with mitral valve disease, if they live long enough, will go into heart failure. And so sometimes I will see dogs whose veterinarian has heard a murmur and they've told them that they just need to watch the murmur and wait to see if we have any signs of heart disease. The problem with this recommendation is that if we wait until we physically see signs of heart failure, like coughing, difficulty breathing, we're usually already in heart failure, and it's much more difficult to bring dogs out of that. It can be quite costly. It's usually an emergency, and so we're really just behind the curve already. So what's ideal is that as soon as we hear a murmur, we have a plan to figure out how close we are to going into heart failure, what's the cause of the murmur, and if and when we need to start medication to help support the heart. Now, it's never wrong to go ahead and pursue imaging with x-rays and an echo as soon as we hear a murmur, but for many people, the financial burden of that makes them want to wait. We can be creative in those situations. So sometimes we'll start with just x-rays. The biggest thing I want dog owners to know is that a heart murmur, one, is not necessarily a devastating diagnosis or piece of news. It's just a sign that something may be going on with their heart. If they're middle-aged or older and small breed, it's very likely they have mitral valve disease, and it's a really great idea to confirm that and stage it and see if and when we need to start them on medication that can help their heart pump better and support their whole cardiovascular system. The best thing that can happen is we hear a murmur, we pursue imaging, then we do an echo, and we find mitral valve disease, but it's a low stage, which means we don't need to treat it yet. And at that point, then we just plan on monitoring that ultrasound of the heart, and then eventually we will usually get to the